What if the real key to better health, what if it wasn't some new drug or a super high-tech procedure, but just a different kind of conversation? Today, that's exactly what we're going to dig into. We're looking at a huge shift in healthcare, all through the eyes of a veteran nurse practitioner, Mary Huntley, to really get at what it means to heal.
And it really all boils down to this one simple, but honestly pretty powerful question. What if that relationship between a patient and their doctor or nurse wasn't just a transaction? Like buying something at a store. What if it was a real, honest-to-goodness partnership? That's the big idea we're unpacking right now.
So, this quote from Mary Huntley, this is basically our North Star for this whole conversation. I mean, think about it. This one sentence, it kind of challenges the entire foundation of how modern medicine often works. It's suggesting a really deep, profound change in the way we should be approaching care. Okay, so how do we even get there? Well, the first thing we've got to get is that patient-centered care isn't just another buzzword. It's not a box you can just check off a list. According to Huntley, it's a total, complete shift in our basic perspective.
Right? So what does this mindset actually look like when you're in the room with a patient? Well, it's really built on three big pillars. First, there's respect for the person's unique story. Then you've got genuine empathy for what they're going through. And finally, it's about active collaboration. It's that huge, crucial move from doing things to a patient to doing things with them. Big difference. And here's the thing that's just so crucial to understand. Before any pill or procedure can really do its job, the patient has to feel, well, seen. That feeling of being heard, of being valued, it's not just a nice little bonus. It's the actual foundation. It's the soil where real healing can finally start to take root. Which naturally brings us to the very first key practice. And it's actually a pretty simple one. The art of just listening. Huntley calls this the absolute cornerstone of compassionate care.
And this slide really lays out two totally different ways of thinking. On one hand, you've got the approach a lot of us are probably familiar with, right? It's all about efficiency, symptoms, checklists, speed, just get it done. But what Huntley is arguing for is a focus on effectiveness. That means understanding the whole person, their life, their context, and actually taking the time to get it. It's a massive shift from just asking how fast can we do this to how well are we doing this. This really flips the script on how we view empathy, doesn't it? It's not some soft skill. It's not an optional extra you sprinkle on top. Huntley makes the case that it's an absolutely essential clinical tool, just as vital as a stethoscope. See, because empathy isn't just about being nice. It's about getting your hands on crucial clinical information. It's what helps a doctor or nurse understand the why behind a patient's choices. And that leads to way more accurate diagnoses and treatment plans that actually work. So what happens when you put that deep listening together with real clinical empathy? Well, the whole dynamic just shifts. A real partnership begins to take shape. You move away from that old one-way street of a doctor just dictating orders, and you move into a space of true collaboration. And, there's a really clear path to building this kind of partnership. It's kind of like a chain reaction. It starts with active listening, right? That listening builds trust. Once you have trust, you get transparency. And that transparency, that's what opens the door to real collaboration. Each step just flows right into the next. And the result of all that? Shared decision-making. When patients are actually involved in creating their own care plans, they're not just passively receiving treatment anymore. Nope. They become active, empowered players in their own health journey. And honestly, that changes everything. Now, of course, a real partnership has to be built on honesty. Huntley is really clear on this. Transparency is non-negotiable. Patients deserve clarity. And get this, even when the news is difficult, if it's delivered with real compassion, it doesn't break that trust. It actually makes it stronger. Okay, so we have to talk about the elephant in the room here. Technology. I mean, in this super digital world we live in, how do we use all these powerful new tools without losing that essential human touch? That's the big challenge, right? Technology, it's kind of a double-edged sword, isn't it? On one hand, it has this incredible promise for efficiency and gathering data. But on the other, there's a real danger. The risk is that the computer screen becomes a wall, literally pulling the doctor's attention away from the actual human being sitting right there in the room. At the end of the day, technology has to be a tool that serves the human connection. It can never be a replacement for it. I mean, a patient portal can't give you a reassuring voice, can it? An algorithm can't just replicate a moment of true human empathy. It's just not possible.
So after all of this, what's the big takeaway? It's actually a pretty simple reminder that at its very core, medicine is and always will be a deeply human thing.
You know, for all the crazy complexity of modern healthcare, Mary Huntley's central message is incredibly simple, but also really profound. And so we end up right back where we started. The goal isn't just to provide a service, it's to build a true partnership, one that's rooted in dignity and respect and in mutual understanding. That is the real heart of healing. So that leaves us with one last thing to think about. If every single healthcare interaction, every doctor's visit, every hospital stay was built on this model of a true partnership, what's the one biggest thing you think would change in our world?